Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina, and today what I want to talk to you about is how to help an auto injury. And in particular, what I want to share with you are some of the things that you may not be aware of that you should consider when you're trying to get better from an auto accident. So first of all, there are a lot of different types of injuries that can occur. So depending on the type of injury, that's going to be, the determining factor as to how long it may take you. But let's talk about the most common injury that people sustain when they're in an auto accident. The most common injury is a whiplash injury, and I say whiplash in quotes because whiplash is not a great diagnosis. It's not specific. It's just basically called a sprain strain injury, and it's oftentimes talked about as if it's not a problem at all, as if it's just muscles and ligaments. Well, the ligaments of your body, they hold the joints together. So if you sprain a ligament, that's a tear. If you tear a ligament, and a ligament's like really tough canvas, okay? It doesn't stretch much at all. It actually connects bone to bone and keeps the joint in place. If you tear a ligament and you lengthen, the ligaments often lengthen, they'll rip and they'll lengthen some, and then they'll scar back. And when they scar back, the joint becomes loose. Like if the bones of the spine stack on top of one another, I can show you with a model, it's probably a little bit easier. The bones of the spine stack on top of one another. This is a model spine with two bones of the spine and the disc. They stack on top of one another. If you tear the ligaments that join the spine together, there are 10 ligaments that connect all of this together, these bones together. They're not here because we're just looking at the bones and the disc in this model. But what will happen is the bones will move. So you see how there's a little shift here? Look at this disc and the bones above and below as I wiggle it. See how there's that movement, that shifting? Now it can also happen side to side. See how there's shifting, that movement? What happens is that movement can become a lot more than what I just showed you. It can actually shift significantly. And when you bend forward, there can be increased rotation and bending, which puts a lot of stress on the joint and causes accelerated degeneration, which means arthritis and a lot of spine problems in the future. So one of the things that's really important to understand is that when you're looking at an auto injury, getting an accurate diagnosis is really important. We take very specialized x-rays and use a computer program that is used in the scientific literature and research to determine if that's happened to you. We're the only clinic in Western North Carolina that is currently doing this, and it's something that I think is the only way. It is the absolute minimum. We have to do this and uphold this as a standard of care, because we all know someone that's been in an auto accident and they said, my life's never been the same. My back still hurts, and they have some form of disability, and they've lost some kind of function, or they're in chronic pain because of this. I mean, how many people do you know that have been in a car accident and they have pain forever after that? And it predisposes them to being addicted to pain medications, and people will look at them and say, or look at their spine, they'll take x-rays and say, yep, there's nothing here. You don't know that. There's no fractures there. But if you don't take the specialized x-rays that we use, if you don't measure it using a computer that can compare it to what is normal in the scientific literature, it's not my opinion, it's fact, then you don't know if there's nothing there. And these people oftentimes have, people that are in car accidents oftentimes have severe ligament tears that cause looseness or instability in the joint, and it's missed. I've seen thousands of cases, and I've never once seen anyone but our clinic do this analysis. And the fact is, one of the reasons it's not done is because the software to do the analysis is a significant investment. It's not a cheap software at all. And the other thing is you have to be trained in how to do it. And beyond that, there's no increased reimbursement for you as the doctor to do it. So it's really like, if people look at it and they're like, well, it's going to cost us more and we're not going to get paid anymore. It's going to take us more time, so we're not going to do it. We refuse that. I refuse that. I refuse that model. We're going to uphold a higher standard here. We're going to help people, and we're going to make a difference. We're not going to do it just because the insurance doesn't pay for it. We're going to do it because it's what has to be done. It's what needs to be done. It's what every person deserves. So, when the things that can help an auto injury is, number one, how what we do helps auto injuries is, first, we help people get the right diagnosis. We help them figure out what's going on so that we can determine if what we do can be beneficial to you, or if you need to see someone else. Do we need to refer you? Do you need an MRI? Do you need any other type of workup so that we can get to the bottom of what's happening? Because if you don't know what's going on, how can you properly formulate a treatment plan? How can you actually help someone get better if you don't know what's wrong, right? Well, I'll tell you what, you can ensure that someone's never going to get better if you do a half a halfway workup. If you don't take the time and you don't do the things that need to be done, you're never going to figure out what's going on with someone, and that person's going to suffer from that for the rest of their life. So it's our mission to uphold a higher standard, and one of the things that we do is we take we really take the time to figure out what's going on with people so that we can determine what do they need to do to get their life back. So I want to share that with you so that you had an idea of really how to help an auto injury. Number one, get the right diagnosis. Get someone that's going to do a thorough workup. Get someone that's going to try to help you naturally, non-invasively. First of all, to see if they can help you get better without drugs, injections, and surgeries. If you can't, then get to someone. If you can't, then make sure you're with someone that has a network of doctors they can refer you to, and that they appreciate the fact that you might need something more than what they have to offer. Right? So we always work with people in phases. We do trial periods of care to make sure that you're going to respond to what we're doing. If you don't respond, then we reevaluate. We say, okay, why aren't you getting better? You should be getting better. Do we need more information? Do we need an MRI? Do you need to see a specialist for another opinion? Do we need to change our treatment plan? These are all possible things, but you need someone that's always working on, okay, are you getting better? Are you responding to the care that you need to have? Do we need to collaborate with someone else to help you, right? So anyway, it's kind of a rant because I've seen so many cases where that hasn't been done, and it's unacceptable. So I hope this helps you guys to better understand how what we do in our clinic might be able to help your auto injury. Now, I'll do the best that I can for you. If you'd like my opinion on your injuries, don't hesitate to give us a call. Our phone number is 828-324-0800. My staff will help you schedule an appointment. I'll do the best that I can to work you up, and I will help you figure out if I think you're a candidate for what I do or if you need to see someone else. And if you need to see someone else, we'll help you make the appropriate referral to the appropriate specialist. If you need an MRI before initiating treatment, we will get that for you. So we will help you figure out what's going on, and we will always put you first and do what's right for you. So if there's anything we can do, don't hesitate to reach out and give us a call. We'll help you out as much as we can. But I hope this helps you better understand some things that you need to consider to help an auto injury, and I hope you have a great day. Thanks.